pregnancy and type 1 diabetes. On today's episode of The Leap, we turn it over to Jessi Thaller-Moran, Leigh Lipsi, and Lesley Day. Three amazing women living with type 1 diabetes who have navigated the intricacies of pregnancy and childbirth. In this episode, Jessi, Leigh, and Lesley not only share their own experiences from their journeys to motherhood, but they also cover important topics such as how pregnancy affects blood glucose management and insulin needs, diabetes resources they found helpful while pregnant, the importance of having a solid support system, and a ton more. This episode is a phenomenal resource filled with firsthand, real-world diabetes wisdom. So without further ado, let's go ahead and get into the episode.
Okay, so welcome to the DFC. Tonight we have some very special ladies joining us talking about type 1 diabetes and pregnancy. There's a whole host of things we could go into, but we're going to try and focus on some pretty important topics and how we got to where we are. So introductions. Jessi, will you go first?
I will go first, but Leigh, you're also one of the special ladies here to talk about diabetes and pregnancy, so you're not getting off the hook.
Yeah, come on now. Okay.
So I'm Jessi Thaller-Moran. I have one child. I have a boy who was born in May 2018, so he is almost 2.5. I'm a lawyer, so I am a planner, and that's going to come up a lot, I think, when I'm talking about my pregnancy story, just because, just like everything else in my life, I like planning an organization. So there you go.
It's good. I'm a planner too. And you'll hear a lot about planning in here. So my name is Lesley Day. I have twins, a boy and a girl, Jake and Griffin. They're 13. So had them in 2007. And I have been a type 1. I'm 45 years old, and I've had type 1 since I was 6. So I've been a type 1 for many years. So now I'm past the baby years. I'm in the teenage years. We'll have another podcast about teenage years. But today we're just talking about pregnancy. So Leigh, what about you?
Awesome. So I'm Leigh Lipsi. I have 2 little guys. Sonny is 7 and Eli's 6. I've been type 1, I'm 37, so 27 years, and I had 2 C-sections. The first one was an emergency C-section, and then the second one was not, and I fought several doctors on both of those, but very thankful that both of them had a healthy birth, and they're good. Yay. Okay, so we're going to go just dive right in, and let's talk about planning. So Jessi, what did you know about type 1 diabetes and pregnancy before you got pregnant? You know, how did you learn it? Where did you get it? And what type of planning did you do pre-pregnancy and during pregnancy?
Yeah. So, I mean, I think it's funny, like, you know, we were talking about planning for this podcast. I think there's an expectation that a lot of women go into adulthood, women with type 1 go into adulthood being concerned about pregnancy and type 1. And I guess I kind of had my head in the sand about the implications growing up. Like, it never really crossed my mind as a complication or a challenge. And then when I reached kind of my mid-20s and I knew that I was getting to the point that I wanted to have babies and kind of taking my diabetes more seriously anyway, started to kind of wrap my arms around kind of the possible complications and understanding that it really was important to have control going into pregnancy, right? Because it's that first trimester where the baby's like form is created, you know, like the rest of pregnancy is growing and getting stronger, but then at the beginning, that's when, you know, the skeleton is being formed and the head and the face and all these crucial parts of the body. And so once I had a better sense of that, I brought it up with my endocrinologist and ended up making an appointment with the clinic that saw me through my pregnancy, which was the perinatal clinic at Duke. And so I went in just to have like a consulting appointment. I was like, what do y'all look for? What are things I should have on my radar? And apparently that's so uncommon that like they kept forgetting I wasn't already pregnant. So I was like in my appointment and the next person would walk in and be like, congratulations. I'm like, yeah, I'm just a really good planner. But the appointment was good just to kind of wrap my mind around kind of where I was at and what I needed to, you know, shoot for in terms of target A1C and all that, I figured out I needed to bring my A1C down a little bit from where it was sitting. And this was kind of before the CGM was quite as accessible as it is now. And so I actually did like a 2-week, basically like insulin test. Like I ate the same 4 meals for like 2 weeks straight. And I had a spreadsheet and I had my CGM on for some of those days. And so I was figuring out like, okay, if I bolus like this, I react like this, kind of recalibrated all of my basals. It was a pain, but honestly, it was really helpful because it helped me kind of hone in on that little bit of tighter control I needed to really be in range. And then the other thing that I did on the recommendation of my doctor was I started taking prenatal vitamins before I even went off birth control, because some women get pregnant so quickly that if you don't have that built up stash of folic acid and all those other good prenatal vitamins, I should say I'm not a doctor. None of us are medical doctors. Leigh is actually in the medical field. So I'm speaking kind of secondhand, thirdhand knowledge here. But my understanding was that it was good to get on the prenatal vitamins on the front end. And then it did end up taking me, I think, almost a year to get pregnant with Alexander. So it turned out that that was a little bit overkill. And I went through like a bottle and a half of prenatal vitamins before I was actually pregnant. But I was very prepared by the time he was ready to grow.
You had good nails. You had good nails.
Yeah, good nails, good hair, all that stuff.
Yeah. Awesome. Lesley, what about you? How was your planning, and where did you go for your resources? Tell us how you got there.
Really similar to Jessi. Like, when I'm getting older, I was not thinking about anything, right? You're just trying to keep everything and have a good A1C. And then when we got serious about starting a family, I went to my endocrinologist and I just started asking questions about what are some good targets and where should I be for this, and a good evaluation of where we were, and then a game plan of how we're going to make some changes. So I did the exact same things as Jessi, where we were just trying to get the basal rate stuff right first, and a good insulin to carb ratio for boluses, and knowing that as soon as baby was growing, all of that would change like every 2 or 3 weeks. But we had to get good on the front end. And I started prenatal vitamins early too. So my biggest resource was my endocrinologist. And I never went to another physician though until I was actually pregnant. So.
And what's funny about that, jumping in real quick, is there's not, our babies were born over a decade apart, Lesley, and like there's really not a ton of good resources on the market for women with type 1 thinking about having a baby. I think I found one book on Amazon that was published like this decade.
Right.
So, I think networks like this and your endocrinologist are really going to be your best source of information.
For sure. I totally agree. That was, I think other than Googling and finding these threads that make you want to go hide in a closet, you're looking for that concrete data and just learning. What's funny is I did the same thing as both of you. I went pre-pregnancy to a clinic in Charlotte that specialized in pregnancy because I didn't know, and I just wanted to be prepared. And you kind of like transition from that coming out of college and being a young adult, and then just really wrapping your head around like, oh, I'm about to grow a human. And so how do I do that?
And it's not just about your body anymore.
No.
Right?
And
like, it's about me and somebody else. And so a whole nother level of like thinking through things.
Yeah. And caring. I think I don't know. I just think it's something changed in me right around then where I just cared so much more about what I was doing. And I think that's being a mom in general, but just it happened kind of even pre getting pregnant.
Right.
Okay. So labor and delivery, I think we all have different stories on this. So Jessi, let's start with you. What was your labor and delivery like? And was it what you expected, what you planned for, or was it totally different?
Totally different. If anyone actually has an L&D story that goes according to plan, I feel like they're like in the minority, even if they don't have type 1.
Yeah.
So I was told all along that I would probably need to be induced around 37 weeks. I think that's pretty standard. Again, my understanding, not as a medical professional, is that that's when the baby is considered full term, but before those last couple of weeks when babies growing and women with diabetes tend to get really big and pack on those extra couple of pounds. So I'm tall, I'm 5'9". My husband is 6'5". So we kind of knew we were going to have like a sturdy kid anyway. And so we were planning.
Sturdy is the word.
Sturdy. He's still plenty sturdy. Yeah. But so we were planning on that like 37-week window. And again, being the planner that I was, they let me schedule my induction for a Monday. So I went to like 37 in 4 days because I wanted to like finish my last week of work so I could have my full maternity leave starting on Monday. So I delivered at Duke. I went in and got, all set up to be induced. They had done an ultrasound on me the week before and they told me he was measuring at like 7 pounds. And I was like, oh, what a reasonably sized baby. He was 8 pounds and 10 ounces when he was born. So they were off. However, so they did the induction, which depending on the doctor you work with, it might be through like an IV drip or it might be through some manual sources. And they tried both on me and I was laboring. And then Alexander decided that he just wasn't in the mood to like have his heartbeat while I was laboring. And so it became like a scary triage situation. And it's funny to talk about it after the fact because, well, one, because we know he's fine, he's healthy. But two, because I went into this weird like out of body mode where like I knew it was happening, but I was just like, yeah, that's cool. That's cool. We're going to just like take care of this, And my husband, I think because he didn't have the distraction of labor, like his recollection of that hour and a half is like terrifying, So they ended up stopping my contractions, getting me in for a C-section. I had 2 epidurals, neither of which took. So they ended up having to do a spinal block to get the C-section completed. So it was an adventure. But I guess I say all that with my out-of-body experience caveat to say we were healthy. Thank goodness for modern medicine. He came out, beautiful, perfect baby. And there are times that you just kind of have to trust the process and know that you have a whole team of medical professionals who are in tune to what you're doing, what the baby's doing. There are all kinds of machines hooked up everywhere. And, thank goodness they realized something was going on and we were okay.
That's awesome. I keep coming back to, this is like a repeated theme in my life lately, but just giving thanks for providers at our fingertips, right? And not only is it just with type 1, I think anywhere, if something happens or it's scary, you kind of go into that like fight or flight mode of, and you've got this amazing team that's taking care of you. So that's awesome. Mm-hmm. Yep. Lesley, what about you? How was your labor and delivery with the twins?
So my pregnancy was not even anything normal. And so I think I'm just reflecting as I'm listening right now that all 3 of us were, and I'm sure everybody listening out here, when they get to this point where they know it's time, they're ready to start a family. I think every female gets to that. And, all 3 of us were blessed enough to have the ability to carry a child of our own. Right. But not every female goes down that same path. So I think we all probably start the path the same way where we're ready to start a family, but whether you have diabetes or not, like everybody's path diverges from that point. So my pregnancy was a little different. I was carrying 2. I was carrying 3. So we started with 3 and we ended up with 2, so I had to have a surgery kind of in between. And none of this had to do with diabetes, but I had diabetes. So my endocrinologist helped me through every step of the way. And what I realized was most other doctors just don't know how to handle stuff. So like, it was me, like I knew my body more than anybody else. And I knew what I needed to take care to get me through, the day or whatever that was happening at the time. But my endocrinologist got me through, who's Dr. Morris, got me through a surgery. And with that surgery, I had a really high probability of going into labor around 31 weeks or 32 weeks. It was just really known that if you had this surgery that is 95% of the women were going into labor around week 31 to 32. So when I was getting close to that, probably about a month before, and I was feeling great, my endocrinologist said, it's time to fatten up those babies just in case. So she urged me to begin running my blood sugars a little higher. So y'all, this is just my journey. So this is not, don't follow my medical advice. So we did, and we beefed up those babies to where I did go into labor early. We tried to keep them in, but they weren't ready for that at all. They were ready to come. So in 31 weeks, emergency C-section. The babies came, and they were healthy, and I was healthy, and so we were able to make it. And they did beef up. So, you know, if we would have kept going, I think both of them would have been 8 pounds apiece. So at 31 weeks, one was 4 pounds, 15 ounces, and the other one was 4 pounds, 10 ounces. So I was carrying about, 9 pounds of baby already in there. So that's my story. There was a lot to it. And I was so thankful that I ended up with like healthy babies. But it was C-section. A vaginal delivery was never a choice for me just because of how it came. And I really didn't care how I got them out. Like, I was just like, I'm just ready to have healthy babies and that they get here. And I think if we've got 20 women on here to share their stories, I think every one of them would have a little bit different story, whether they were type 1 or not. We just happen to be going through a journey and have type 1 too. But the amount of insulin, so I'm going to go back to having diabetes, the amount of insulin that I needed, like at the last week, was astronomical. Like, I just never knew I could take so much insulin at one time. I was like, oh my gosh. And it literally went back to my pre-pregnancy insulin needs the day they were born. Like, the day they were born, boom, done. I went from like 100 units to 30 units in a day.
Yeah.
It was crazy.
I think that is, when we talk about resources, and this can kind of lead into this, the resources that we use, the biggest thing for me that helped was like learning the why behind, why are insulin needs increasing, why, and then I had no clue that the placenta was insulin resistant naturally. So, nobody ever told me these things. So until I went my first pregnancy, I wasn't a CDE until after Sonny was born. So I remember in nursing school, the chapter on diabetes, I was like, oh, like, that's why. But that was huge for me, is learning the why. And I think that is what I would encourage any type 1, is to really learn the why. Because no, there's not one book that's going to tell you, but there's a lot of great resources in terms of looking up, like, why do insulin needs basically quadruple, and it's because around week 24 is when the placenta is producing those hormones, and it's naturally insulin resistant, diabetic or not. It's just, if we're diabetic, our bodies don't naturally have that increase. So I was right with you in terms, I think my carb ratio was like 1 to 3 by the end, and the insulin needs. And then as soon as that placenta is delivered, you're back where you were, which is crazy, right? And the importance that comes behind planning. Like, if you don't know that, then you start bottoming out after and you're on a pump and you're in the hospital. So I think the planning that comes behind that, and just wrapping your head around why, is huge. It helps just calm, I think, a lot of the unknown and the not necessarily anxiety, but just I think we all, diabetic or not, we have that fear and the unknown of what is it going to be like, and then you're low and you're trying to breastfeed and you're trying to feed me. Like, but if you can be like, all right, as soon as I deliver, I want to
a pecan pie. I want a pecan pie. That's what I ate.
Thank you.
You earned it, man. But I do think one thing that's overlapped in all 3 of our stories too is the importance of being your own advocate. And like Leigh, you're saying, for me, I really needed to know the why behind it. And Lesley, you're talking about working with Dr. Morris on your specific situation. I think the important takeaway maybe for someone who's thinking about getting to this stage is that, just like with with diabetes management in general. You can have the best medical practitioners in the world, but they won't know what you need to know to feel secure and to take the best care possible of yourself. So I think that starts way back in the beginning of your pregnancy journey, like figuring out what you need to ask and whether they recommend you see another specialist to make yourself feel better, all the way through to, figuring out whether the hospital will let you have your insulin pump with you during labor, or if they're going to switch you onto an insulin drip. Figure out what's important to you and don't be afraid to ask the questions, because most practitioners are, they're used to a one size fits all because they just don't have time to customize to everybody. But if they know you have that special interest or that special need, a lot of times they can hook you up.
Yes.
Well, here's the thing, even in like your own personal care right now, right? Mm-hmm. So you can do all the reading, you know that your insulin needs are going to go up over time. Mm-hmm. Maybe like those first like early trimester, they actually went down a little bit and then they went back up. Like that's how mine went, right? But you could read that online, but nobody is going to tell you then what you need to adjust yourself, right? Maybe your physician is watching you every day, but really you're doing it. And so the pre-work that I did ahead of time to make sure that my basals were right, mm-hmm. and that my insulin to carb ratio was right, meant if I wasn't getting the results I needed, my blood sugars, the results that I needed, then I knew, and I did it for like 2 to 3 days, that was my indicator that I needed to increase my basal. Mm-hmm. Like, oh, okay, then whatever has happened inside, that's what I've been reading about. It's time to increase my basal by 10%. Great. And then I would sustain insulin to carb ratio and things would work again, right? It was me understanding how my body was doing it and just being on top of it, because that's really, you're taking whatever information and then nobody can tell you, like, you got to do it yourself, I mean, just babies are not like, you got to end up to come and do it yourself. It's just even more imperative that you are paying attention to it ahead of time, because you can do this. Like we did this, all 3 of us, like we did it and we ended up to be fine and the babies ended up to be fine. And like, just take the lead, like take that little bit of knowledge and then own it, like just own it. And you can have healthy pregnancies.
Yes. And live with it, not for it. Live with diabetes, like be pregnant with it. But I think you can easily let that fear of like harming the baby and what is this blood sugar going to do? And you can be consumed by it. And then you miss your whole pregnancy, And so I think the joy that comes from just becoming a mom, we talked about this, like not every woman can get pregnant, and some of the most beautiful families that we all know are through adoption and through or not having kids at all, but
families, or
I think one thing I've learned, I think in pregnancy probably showed it to me most of anything, was just that a lot of times our fears don't come to fruition, right? The way we think they are, or they're going to be different. And so really just living in the moment and making decisions, diabetic or not, healthy decisions for your body and for, but don't become consumed by it to where it's causing anxiety and stress, because then your blood sugar is going to go up, right? And that's no fun. So I think that was really important for me learning, because I felt myself in the beginning get real, what am I doing? And is this harming the baby? And my blood sugar's 200. What am I going to do? And that faded as I just really focused on the decisions that I was making. And like you said, Lesley, you have, and Jessi, you have to be your own advocate, right? And so, okay.
Tell us your delivery story, Leigh.
Oh man. Okay. So Sunny, so actually, placenta degradation is kind of common, can be common in diabetics. So that means, it's kind of towards the end, and an indicator of that is that your blood sugars start going down, towards the end of pregnancy. Hindsight, I do believe I was just becoming really, really aware that I was getting ready to deliver, and I was really trying to keep those blood sugars great. But they hospitalized me about 3 weeks before Sunny was due And he ended up being born at 38 weeks at 9 pounds, 13 ounces. And that was with like a 6A1C the whole time. So, I mean, I think my family naturally has bigger babies.
That's the thing, yeah.
Yeah, like I talked to my mom, like I'm the only type 1. And so, but I had eaten that morning. I knew he was just full, like I had eaten and he was just sleeping. But maybe like Alexander, he decided that he just wasn't going to move. So during the scan, they were like, we're taking him now. My husband was not there. I didn't have a cell phone on me. So I was like asking the tech, can I borrow your cell phone? I think my husband wants to be here. You know, can we just put this off for a little bit? So I wasn't concerned. Like I just had this very calm, kind of like you. It was weird. Like I just was very calm. Like we're good. He's good. We're good. And he was fine. He didn't have to be taken to NICU or anything like that. No low blood sugar. He was just huge. Like he was huge. And then with Eli, I had a C-section fighting. I fought 5 doctors on it. And my husband finally looked at me and was like, look, it does not matter how they get here, you know, and you need to listen to these doctors. So I did, and I'm very thankful for it. They both were great and healthy. And so I'm very thankful. Even the way I view birth is no matter how you birth, you know, kind of the same way, no matter how you become a mom, like it's beautiful and it's just its own story. And so, yeah, I was thankful for it. Yeah. Okay, so let's move to post-delivery. Jessi, we'll start with you in terms of breastfeeding and jaundice and NICU, your support system and blood sugar management. What was it like right after giving birth, and how did that affect your blood sugars, and how did you manage those first couple weeks postpartum?
Well, I mean, the insulin piece that you all were just talking about, definitely. My endocrinologist had me screenshot my basal rates right when I got pregnant, which ended up being hugely helpful because after going through the delivery experience, you know, I was sleep deprived and, you know, my hormones were raging and I was so focused on this beautiful baby that like, I had no idea what insulin even was, you know? So it was great that I had something written down that was like, okay, this is what I need to switch to. Alexander was jaundiced, which happens not uncommonly with preemie babies. And so I actually ended up pumping in the hospital because we were trying to get as many fluids in him as possible to kind of flush that out and make sure that he was healthy and strong enough to go home. And so we ended up being in the hospital a couple of days longer than I wanted because he had to go into this like a baby tanning bed, basically. I don't remember if it's a UV light or what they put on him, but kind of to just flush his system out. And they wanted to make sure he was healthy before we went home. And so that was really hard actually, because staying in a hospital, you know, you're not getting good rest because people are coming in and out of the room all the time. Plus you have a newborn, plus, you know, all of the emotions and the hormonal shifts that come from post-delivery. And it ended up, my husband and I had been convinced in the beginning that we just wanted it to be us when we got home. And it got to like Thursday of that week. And he, to his credit, just like pulled out the white flag and he went in the hallway and he called both of our parents and he had his parents come pick him up so he could go home and like sleep and take a shower and, you know, get a change of clothes. And my parents came to the hospital and stayed with me and helped me. Like they had me like monitoring him in this little like blue light bed and like he had to wear these little goggles. And I was just I was crying all the time. Like so that was a time, like, I think, you know, talking about your delivery plan not going according to plan, I had this idea that we would like learn how to be a family first and then we would bring these other people in. And it turned out that like, I was so thankful we had this support system to kind of step in and even just to be there, you know, more so than doing tangible things, just ended up going a long way. And then, so we went home that Saturday and, you know, then it was just the transition of being at home with a newborn and having diabetes on top of that. So being really reliant on my CGM because I was so sleep deprived a lot of times. I did not feel as in tune with my blood sugars as I normally would. Learned pretty quickly to stash low supplies like everywhere, like up in Alexander's room next to the rocker I was using downstairs next to my bedside table. Anytime breastfeeding tends to drop blood sugar. So a lot of times I would have to treat a low if I didn't adjust in advance of breastfeeding. And just the last thing you want is to like, you know, be holding this tiny precious little newborn and realize that you're like not sure you can safely stand up. So I think there was a learning curve there. But I mean, I tell people all the time, my maternity leave experience was like the best 12 weeks. Like it was just, it's such a, and I was very, very lucky I had 12 weeks, I should say, but it's just such a precious, unique time. And, you know, never again in your life do you get this time to just like slow down and stare at this beautiful creature you just made. And I watched a lot of Netflix too. I mean, I didn't just like stare at it the whole time. I've not watched that much Netflix before or since either, but it was just a really great time. But yeah, the support system was definitely key.
Yeah. All right, so mine was a little different because mine were born at 31 weeks. So they went straight to the NICU. We had no jaundice issues whatsoever. At 31 weeks, they really weren't even supposed to be breathing necessarily on their own because they don't really, they're so young, right? Everything is not formed. But before I gave birth, they did get the steroid on board to help their lungs get ready. And so I was able to keep them in for a good 2 days, which is how long they told me I needed to keep it in once I got that shot. That sent my blood sugars through the roof, and that's why I had 120 units.
Oh, wow.
120 units. Like I went past my like stuff on my pump. I was like, oh my gosh.
You were literally changing your cartridge every single day. Those last couple.
I mean, it's like checking it every hour. And so just so it wouldn't hit like 400. I mean, it was, so we were checking every hour bolus, checking every hour bolus. For 24 hours, I did that. So I was exhausted. So anyway, babies came. They indeed could breathe on their own, which was awesome. So their biggest issue was maintaining their temperature and being able to feed. So babies do not learn how to suck until like week 36 in utero. So they had no idea how to suck at 31 weeks.
Oh, wow.
So that was why they were in the NICU, was maintaining temperature and learning how to suck. So after 2 days of being in separate little cribs, they put them in the same crib, and then they started to thrive. So that was beautiful for them. Mama was all stressed out upstairs because I couldn't be with them every minute. And so the diabetes was like the last thing that I thought about, like last thing. So thank God I had some friends that remembered to tell me about needing like some of those pads for your breasts because you leak. Okay, I did not know that. Like, I didn't know. I mean, I had nothing to do. I had all my diabetes supplies, but I didn't have that. Like, I didn't know. Like, there was so much I didn't know. And so I had this friend of mine, bless her heart, who packed me this bag. And, like, she didn't even tell me what was in the bag. And she was like, you're going to need everything that's in that bag. I was like, oh, Rena, that is so sweet. Thank you for, and I started pulling out and stuff. What is this? And in about 24 hours, I realized why I needed everything that she had packed in there. So I took care of my diabetes. Like I had all my stuff. I didn't have any of that stuff. So friends are awesome. So make sure you got some friends who have been through it because they're going to tell you stuff that no one else tells you, which is really helpful. My kids were in there for a month. So I got released after a week, and I was going back there every day, and I would stay all day. And because they were preemie, we could only touch them once every 3 hours. So I would sit there until that third hour would come where I can touch them, hold them, and they were getting fed through a tube. But we would practice sucking every 3 hours. And the doctor said, hey, when they get it, they're going to get it. And when they get it, we just need to see them feed for 24 hours. Literally, when they got it, they got it. And they fed for 24 hours and we were out. Mind you, I was low all the time because I was trying to get my insulin stuff right. But I was pumping. And so like my body just couldn't keep up. I couldn't eat enough. But it wasn't even the focus. If I have to be really honest and transparent, like I just fixed the low and I went, like it's just in that mode. I just fixed the low and I went, and I just kept going because you're just not thinking about it at that time. So if I have to speak to my younger self, if I could go back, Jessi, your doctor telling you to take a picture of what your basal rates were and what all that was awesome. Like,
Yeah.
I wish I would have done that because I didn't know, either. So that would have been, that's really helpful. Stash and low stuff everywhere, had it everywhere. I wasn't on a CGM at the time. So that's a big deal. And it was actually my kids that got me on the CGM, because I came home one day, and by the time I walked into the door, I realized that I needed my husband to help me, and I never have to have somebody help me. And I was like 40, and I didn't know it. And I was in the car with them. And I called my doctor immediately, and I was like, I got to get on the CGM. So I don't even know how I did it without one back in 2007. But anyway, it took me a couple of months to adjust. So if I have to be honest, like, it took me a couple of months to get my diabetes back right. Like, number one, I wasn't even thinking about it, but you're tired, you're not sleeping, your hormones are all over the place. So I was either like really mad because everyone was holding my babies and I wanted to hold them, or I was really crying because I needed to go to Target because I needed to get out the house, but then I felt guilty to get out the house. And like, I was like, oh my God, I just so many apologies. But after that, you get your mojo back. It takes you a little bit of time. And that's whether you have diabetes or not. But it just takes you some time to get back into the cadence of you and feel like you again, and all of that. But when we finally got the babies home, it was after a month. And mind you, so for a month, I was only touching them once every 3 hours. I only missed 2 feedings a day for them. So I was in the NICU all day. Okay. We got them home. And so then my husband and I were like, oh my God, I'm not sure that like we know enough to get them home. Like, I'm not sure that is. And so we got them home, like and they're all in their little, we had like these little baskets. So we had them in their baskets, and we were sitting there like on the couch, and I was like, like, can we touch them? I'm like, are we allowed to hold them? I'm like, yeah, we're allowed to hold them. So we got them home now. Anyway, that was mine. I feel like it was a long while before I got back to normal a little bit, but I had a month where I was going back and forth to the hospital for a while. So
I think diabetes burnout is real too. I mean, you've been watching your blood sugar so closely since before your pregnancy, like we've all been talking about. So I think some of it is that like you just take yourself a break for a couple weeks, and I mean, you still watch it as best you can, but you can't be on all the time.
No, give me the chocolate cake. I mean, that was the first, you're done once they're out. That was, I feel like the boys didn't go to NICU, but I did. It took me a while I think it took me like 6 weeks to even function, like even want anybody to come over, or I was just in this kind of, I remember the nurse walked in the first day and I was feeding Sonny and Chubby was feeding me, and because I was low, and she's like, I just want to take a picture of this, it's beautiful. And both of us looked at her like, it's beautiful, all right, but it was beautiful because it was just, taking care, like Jessi said, that support system, and you don't even kind of realize how much you need it. And it's okay to ask, because our bodies, what Lesley just said, like sometimes it's just too much, like the low and the feeding and the hormones and and you just, okay, like diabetes does take a back seat sometimes because you're just fix it and go, like your main, and that's how I was, like the focus was the boys, and it was just, I was dropping a lot with breastfeeding, and I needed to adjust a lot of my basals and carbs afterwards. I felt like I was like really hungry after giving birth. And so I was just like eating a lot, trying to keep up with the demand of, and then having that 12 weeks, I had 12 weeks too before I had to go back, but I didn't feel like that was nearly enough. Like I still felt like a zombie in terms of just being able to function. But I will say, I think, even though type 1 adds this whole other dimension to being a mom, and it's crazy anyways, you know, like whether you're just learning to you just grew a human, and you just you're learning to feed, and it's this beautiful transition into parenthood. But it does still require, you know, that's why we always say at camp, like, it's 24/7. Like, it does not care if you just gave a birth. It's like, well, you're low. Take care of it. Yeah. Okay, so in closing, I kind of want to touch base on a couple things. So two main things. If you could go back and tell your 17-year-old self something about pregnancy and raising children with type 1, what would you tell her? And B, what is the best tip you could give a type 1 diabetes who is type 1 diabetic who is considering pregnancy? Jessi, we'll start with you.
Those are hard.
Those are really hard.
I mean, I think the thing that I wish I had a better handle on at 17 is that better control earlier on gives you more options down the road. Kind of like how, I mean, this is an example, like how in school, making better grades gives you more options, even if you decide not to do something that, you know, those grades go towards. I think keeping your body healthy before you have like a clear purpose for it other than, you know, existing and taking care of yourself just makes it a lot easier when it comes time to, you know, to decide to create another human. Flip like that is I will say, if it feels really out of control and really overwhelming, it's totally possible to harness it and have some control over it. And it is so empowering to get your blood sugars in control when you didn't think was possible, and then to grow a human on top of that. And I mean, you can tell the way that all three of us, I think, have spoken about it tonight, that it's such a powerful, moving experience. There's a reason that I think everyone likes to tell their like pregnancy and birth war stories, whether they have type 1 or not. And it's because it's such a powerful, pivotal part of your life. So, I mean, I that's a long answer, but I guess I kind of combined both of your questions. Like, I wish I'd known to sort of buckle down sooner, but also that it's doable. And when it's done, it just feels so.
Yeah, that's awesome.
Yeah.
Lesley, what would you tell her?
Well, I would tell you, as I've gotten older, and I reflect back at my younger self, I realized how part of me was like, dag blame, like I have diabetes, and I was mad at it, but I wasn't mad at it consciously, right? I'm dealing with it, and it's great, and I'm at camp, and I'm positive, but then there's a part that I was just a little bit like, no, I'm not going to wear a CGM, and no, I don't want to wear a pump, you know, and I don't want to have to worry about that, right? I feel like that was the little inner Lesley, if I could let that person out. And I'm going to go back to what Jessi said. Like, if I could go back and speak to her and say, control is empowering, and being able to learn your body and work with it versus fighting against it all the time. I felt like I know my 17-year-old self was fighting against herself all the time, like all the time. So if I could just go back and say, you know what, if you can just be with her, like her and her body, and be with the diabetes and not working against it, learn how it works. Like, learn how your body responds to something and work with her. Mm-hmm. Because if you're in that space already before you're even considering pregnancy, then considering pregnancy is just easy. You know that you're already ready. So that would be my advice to the 17-year-old person, which is, girl, just drop your attitude and just work with her. Like, work with her. So that's my, this is like a therapy session right now. Who would have thunk? Okay, what was the second question? That was the 17-year-old. What was the second one?
Yeah, the best tip you could give one who's considering pregnancy.
Mm-hmm. I think I'm going to go back to the really understanding your your basals and your insulin sensitivity to things. Like if you can get that like nailed before the baby starts to grow, then I feel like you got a really nice baseline to be able to adjust how you need to. Does that really work for me?
I thought a lot about that 17-year-old lately. I think what I would tell her is our choices directly affect our outcomes, right? No matter what. And they affect us, they affect our family, they affect our friends. So I think when we're young as a type 1, you grow up, especially if you're diagnosed really young, you grow up with parents that can't really let go of you the way they need to, because they're constantly needing that blood sugar, constantly making sure you're okay. And you don't really understand that until you kind of circle back around and you're a parent. But then we get to that age and we just want freedom. And so I was, your typical teenager and just kind of went crazy. And I don't regret it, because I do believe it made me who I am today. And our bodies are resilient. So please, if you're struggling with that, our bodies are resilient. So you can choose to kind of get back on the bandwagon and live an active, healthy lifestyle. And don't tell yourself you have to, tell yourself you want to, because that more than anything just can change the outcome of you're going to love your kids so much that you're going to wish to God that you did everything you could have done when you were younger to just preserve and keep those blood vessels happy. So that's what I would tell her, even though I'm thankful for the lesson that I learned by not doing that.
I think I'd go back and hug her.
Yeah.
Like, just go back and hug her and say, it's going to be all fine. Like, it is going to be so fine. Like, you got this. And, like, surround yourself by, like, wonderful people that, like, love you and support you, like, no matter what phase you're going through. And, man, things will be amazing.
Yes.
That's what I would tell her.
Yes. And the tip, for anybody listening, I think you heard it from all three of us. Get yourself a good diabetes educator and a good doctor. And if you have them, keep them and hold them tight. And if you don't have them, they are out there. There are some amazing providers. And being able to communicate with them and just learn before you kind of dive knee deep in all this. But it's doable. And you can, I loved being pregnant. Some people hate being pregnant, and that's okay too. But I loved it. And I loved learning about more. I just viewed it as a way to learn more about my body. And so I would say just embrace it and get a good team and then dive straight in, because it is beautiful.
Oh, thank you, Leigh, for hosting us today.
Yeah, thank you guys so much for joining us, and we appreciate you so much. And PMA,
wrap it up.
And as always, the content in this video and podcast is for informational purposes only. This content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard medical advice or delay in seeking it because of something you have seen or heard in this video or podcast. Reliance on any information provided during today's episode is solely at your own risk. If you think you may have a medical emergency, call your doctor or 911 immediately. Thank you so much for joining us. We'll see you on the next episode of The Leap.